Today, let's talk about whether HRT might be right for you because this conversation is about more than just hot flashes. Hormones like estrogen, progesterone, and testosterone play an important part in brain health, bone health, sleep, mood, metabolism, cardiovascular health, libido, and our overall quality of life as we age. Now, some women feel amazing on HRT, some decide it's not for them, and some struggle to even find someone willing to have that conversation with them. So, if you're confused about HRT, you're wondering if you're too young, or you're unsure what questions to ask, stick around because later in this video, I'm going to help you cut through some of the confusion and I'm going to walk you through the questions that matter most when you're trying to decide whether HRT is right for you. So how do you figure out what's right for your body? Let's break it down because there's no one size fits all answer out there. The right approach depends on your symptoms, on your health history, your stage of life, and what matters most to you. So, first, your symptoms matter because they're clinical data. Your symptoms help point towards what hormones are most likely involved and what kind of support your body actually needs. So, a woman dealing with sleep and hot flashes might need a different approach than someone dealing with anxiety, mood swings, or even low libido. And your age matters because of something called the timing window. Research shows that women who start hormone therapy before age 60 or within 10 years of menopause tend to see the greatest benefits with the lowest risks. So that doesn't mean older women can't benefit. It's just that if you're in your 40s or your 50s and struggling, acting sooner often maximizes the benefits and minimizes your risks. Your health history matters because it determines not just whether HRT is right for you, but how you take it. Things like a history of blood clots, migraines, or liver issues can shift which delivery method is safest. So, for example, patch and gels bypass the liver in a way that the pill doesn't. Your family history matters because certain histories, particularly hormone sensitive cancers, are part of an honest risk conversation. A family history of breast cancer doesn't automatically exclude HRT. It just might mean you need to look further into what options are best for you. The key is to having a provider who's willing to look at your individual situation with you. And your quality of life matters because it's the one that's most often dismissed. So if your symptoms are disrupting your sleep, your work, your relationships, or even your sense of self, it's a legitimate reason to seek help. You don't have to reach a breaking point before you get support and explore solutions. And when women finally do reach out for help, they deserve to be heard and taken seriously. Too often, I hear from women who do exactly that. They go in, they talk to the doctor, and they leave feeling dismissed. Or they could be handed a prescription for an antidepressant, not even talking about hormones. Maybe you've been told you're too young, or you're told your labs are normal, and that's it. You just have to live with it. Sometimes birth control pills are offered instead of HRT, and I guess it depends on where you are. Are you in early perimenopause, later perimenopause, or menopause? Are you looking for contraception or no? What are your needs? Because they're two very different things. The birth control can be used for contraception, it might be used to regulate your periods. Whereas HRT is replacing hormones that are physiologically low. So the best option depends on you, your symptoms, and what support your body needs. So when it comes to perimenopause, there is usually not one perfect test that's going to give us all the answers. Current menopause guidelines recommend that perimenopause be diagnosed based on your overall picture. So your symptoms, your age, your cycle change, and what's happening with your body, and not on just one hormone number on a lab test. So when you're talking with your provider, those symptoms and changes matter too. So you don't want that conversation to just be around that one lab test that was drawn and you're told your hormones are normal, because hormones fluctuate so wildly during perimenopause that they can be normal, but you're going to still feel completely off. So, if you're in your 40s and you're struggling with sleep, anxiety, hot flashes, brain fog, mood changes, and just feeling unlike yourself, you are not too young to start having conversations about your options. And if you have felt dismissed, minimized, or confused during this process, you're definitely not alone. The reality is that most healthcare providers have received very limited training in menopause and perimenopause. And menopause science has evolved significantly over the past few years. So, this gap is part of why so many women struggle to get clear answers and support. So, before you decide if HRT is right for you, I have a few things you want to really think through and ask yourself about whether this is an option you would like to try. So, here's a few questions. Sit down with a piece of paper, a journal, or just yourself and think through them as you're trying to decide, is this something I want to do? So, question number one: how much are your symptoms actually affecting your daily life? So, are you comfortable or are you uncomfortable, but you're functioning okay? Or are you just not okay at all? So, your sleep, your energy, mood, relationships, work, and your quality of life, how are they being affected? Next, how long has this been going on? Has it just been a few frustrating weeks, or have you been struggling for months or for years and hoping it's going to change? I do recommend tracking your symptoms because that can be real helpful. If you're going in to see the doctor, having those patterns handy is going to be very helpful when you're having a discussion about the HRT. And then what have you tried already? Have you tried lifestyle changes, nutrition, stress management, sleep support, movement, any supplements? Those things all matter too. And if you've been making the changes and still feel like something is off, that's important information. Next, what are you hoping to improve the most? Because every woman's experience is different. And for some, it's sleep. For others, it's brain fogs, anxiety, hot flashes, libido, or just simply feeling like themselves again. And that matters in what sort of treatment you're going to get. So, this is a biggie right here. What are my fears about HRT, if there's any? And it's a big one because for years we were told HRT was not safe and that it caused cancers, and we just didn't know enough. So, what are your fears on that? What are your fears of side effects? Are you fearful that the doctor's just going to dismiss you on that? Because sometimes identifying that fear can help us figure out what information you actually need and what questions you want answered. And the last question: what would it mean for your life if your symptoms actually improved? Because sometimes we've been struggling for so long that we forget what it feels like to sleep well, to feel clear headed or have energy, and just feel connected to yourself again. So you don't need to walk into your doctor's office with every answer figured out, but walking in with a better understanding of your symptoms, concerns, and goals can make those conversations a whole lot more productive and a whole lot harder to be dismissed. And to help you get those conversations started with your healthcare provider, I have created the Menopause Symptom Tracker and Doctor Conversation Guide. It's designed to help you track your symptoms, organize thoughts, prepare questions, and just have a better understanding of menopause and hormone therapy so that when you go into that appointment, you're going to feel more informed and more confident. You can find all the details in the description for that. And just remember, HRT is one tool in your toolbox. It can be incredibly helpful for some women, but it's not the whole picture. Your lifestyle, nutrition, sleep, stress management, movement, and even other non hormonal approaches matter too. There are many ways to support yourself through this phase, and you get to decide what feels right for your body. At the end of the day, this isn't about convincing every woman to take HRT. It's about helping women understand their options, ask better questions, and just know that they deserve the care that looks at the full picture. Because for some women, HRT can be life changing, but for others, lifestyle changes, non hormonal options, or a different approach may feel like a better fit for them. But you deserve support, education, and conversations, not to feel dismissed as you're trying to navigate one of these biggest transitions of your lives. And I think we're all done suffering with this stage of life. So tell me in the comments, what questions do you still have about HRT? Or what has been your experience trying to get help for your symptoms? And for more information, remember to subscribe.